Welcome to today's deep dive.
Yeah.
We're going to be talking about a 2023 article from Veterinary Clinical Pathology
Right.
about the impact of phenobarbital on our feline friends.
Okay.
Now, we know this is a pretty common treatment for epilepsy in cats,
Right.
but there's a lot more to it than meets the eye,
Yeah,
especially when it comes to the potential side effects.
for sure.
So tell me a little bit about what this study was looking at.
Well, this study took place at the University of Veterinary Medicine, Vienna,
Okay.
and they reviewed records from 69 cats diagnosed with idiopathic epilepsy
Okay.
between 2006 and 2021.
Wow.
And they weren't just looking at, how well the phenobarbital controlled seizures.
Right.
They were really focused on what was happening in the blood work of these cats,
Oh, interesting.
particularly changes in their blood cell counts.
Interesting.
So that's kind of what they were honing in on.
Wow. So what was the big takeaway?
Well,
What was the big surprise that came out of this research?
76.8% of the cats in this study developed something called cytopenia while on phenobarbital.
Wow. That's a huge number.
It is a big number.
I know we're going to break that down a little bit more, but 76.8%.
Yeah.
That's almost,
The vast majority.
the vast majority of
Yeah.
cats in this study.
Right.
Before we get into the details of that,
Mhm.
what does that really tell us?
It's a major wake-up call
Yeah.
that blood cell abnormalities might be way more common in cats on phenobarbital than we previously thought.
Wow.
And it really underscores the importance of routine blood work monitoring.
Okay.
Even if a cat appears perfectly healthy on the outside.
Oh, so,
Yeah.
just because they're not showing any signs doesn't mean something's not going on.
Exactly.
So tell me a little bit about cytopenia.
Okay.
We're talking about blood cell changes, but
Yeah.
what does that actually look like?
So cytopenia basically means a decrease in at least one type of blood cell.
Okay.
And in this study, they saw a range of cytopenias. We're talking about neutropenia, which is a decrease in neutrophils, a type of white blood cell that's super important for fighting infection.
Right.
They also found leukopenia, which is a lower overall white blood cell count,
Okay.
thrombocytopenia, or low platelet count,
Okay.
and even anemia,
Oh, wow.
which means a low red blood cell count.
So we're dealing with
The whole gamut.
a whole spectrum of potential problems here.
Yeah.
So tell me,
Yeah.
we're talking about these drops in blood cell counts.
Mm-hmm.
Are we talking about slight dips?
Yeah.
Are we talking about dangerous drops?
Yeah, that's a good question.
What's the severity here?
So that's where it gets interesting because most of the cytopenias observed were mild or moderate.
Okay.
However, there were 2 cats
Mm-hmm.
who developed severe or even life-threatening neutropenia.
Oh, wow. That's scary.
It is.
So,
Yeah,
even though most of them are mild,
right.
we still need to take this seriously.
We can't brush it off.
Yeah.
Absolutely not.
This is serious stuff.
This is where the real dilemma lies because we have this medication that's highly effective for managing epilepsy in cats,
Right.
but it could be causing these silent,
Yeah.
potentially serious changes in their blood.
Wow.
So this study is really throwing down the gauntlet and challenging us to balance
Yeah.
the benefits of phenobarbital with these potential risks.
So how do we navigate that?
Right.
Knowing that, it's such a powerful tool,
Yeah.
but it comes with these side effects.
Yeah.
What's the approach we should be taking?
Well, that's the crux of the matter.
Yeah.
We need to kind of shift our mindset.
Okay.
It's not enough to just prescribe the phenobarbital and assume everything's fine.
Right.
We need to monitor things.
Okay.
So routine blood work is essential.
Okay.
Even when a cat seems perfectly healthy, to catch these changes early on.
So tell me a little bit about the different types of cytopenia.
Okay.
We talked about neutropenia, leukopenia,
Right.
all those things.
Yeah.
Were all of them pretty much equally common in this study?
Well, the most common type was neutropenia.
Okay.
That affected 60% of the cats in the study.
60%.
That's crazy.
It is a high number.
Yeah.
And that one really raises red flags because it directly impacts the cat's immune system.
Yeah, because that's their,
They're soldiers.
they're soldiers fighting off infection.
Exactly.
That's a big deal.
It is a big deal.
What about the other ones?
Yeah.
Were those seen in pretty high numbers too?
They were also observed,
Oh.
though not quite as frequently as neutropenia.
Okay.
Leukopenia was seen in 49.3% of the cats,
Okay.
while 24.1% developed thrombocytopenia,
Mm-hmm.
and 20.3% had anemia.
So while neutropenia is a big one,
Yeah.
we still got to keep our eye on everything.
We got to look at the whole picture.
Yeah, the whole picture.
Now, keep in mind, this study didn't just look at, the types of cytopenias.
Right.
They also dug into, their severity
Okay.
and, really their clinical relevance. So tell me a little bit about that.
Yeah.
What did they find about the severity of these blood cell abnormalities?
So as I mentioned before, most of the cases were mild or moderate,
Okay.
which is somewhat reassuring.
Okay.
However,
Yep.
they did find that 2 cats developed severe or life-threatening neutropenia.
Okay, so even though most of them are mild,
Right.
we still have these 2 cases.
Exactly.
That are,
But they highlight the potential risks.
yeah, they highlight the potential risks.
Yeah.
So my question then is, these cats that had severe neutropenia,
Yeah.
did they actually get sick because of it?
You would think.
Do they have any symptoms?
You would think so, right?
Yeah.
And that's where things get even more intriguing.
Okay.
Because despite these blood cell abnormalities,
Okay.
most of the cats, including those 2 with severe neutropenia,
Okay.
didn't actually show any obvious symptoms.
Really?
Yeah.
No symptoms?
Yeah.
Even with severe neutropenia?
So that's the burning question.
Yeah. How do we catch that
Right.
if there's no outward signs?
Exactly.
Oh,
And that really emphasizes the importance of that routine blood work
right.
in cats receiving phenobarbital.
So even if they seem healthy,
Yep.
these underlying changes could be happening.
Absolutely.
That's kind of scary.
It is a little unsettling
Yeah.
because this study really kind of opens our eyes to the potential for these silent but potentially serious side effects from this drug
Yeah.
that's often considered like the cornerstone of feline epilepsy treatment.
Wow. Okay, so we've got a lot to unpack here.
Yeah.
We've talked about the different types,
Right.
the severity,
Yep.
the fact that they could be silent.
Mm-hmm.
What other important findings came out of this research that we should know about?
Yeah. Well, one of the things they looked at was cats that were on combination therapy, meaning they were receiving phenobarbital along with another anti-epileptic drug called levetiracetam.
Oh, yeah, you mentioned that earlier.
Right.
Didn't those cats have lower red blood cell counts?
Yeah, they did.
Oh.
Their hematocrits were lower than those on phenobarbital alone.
Oh.
While the exact reason for this isn't totally clear,
Right.
the researchers suggested that the combination of these 2 drugs might somehow be affecting red blood cell production or survival.
So adding levetiracetam to the mix
Right.
could potentially increase the risk of anemia.
That's one possible interpretation, but,
Right.
we always have to remember
Yeah.
correlation doesn't equal causation.
Right.
So we need more research to definitively say whether this combination is truly problematic.
Always more research.
Right.
Seems like every answer in this study just leads to more questions.
It's true.
Yeah.
That's science.
Yeah.
The more we learn, the more we realize we don't know.
Okay, so combination therapy is something to keep an eye on.
Yes.
What about the dosage of the phenobarbital?
Okay.
Did they find any connection between the dose and the severity of these cytopenias?
That's interesting because they didn't know. They didn't find any significant relationship between the phenobarbital dose and the likelihood or severity of blood cell abnormalities.
So even if a cat's on a relatively low dose,
Right.
they could still be experiencing these side effects.
That's what the data suggests.
Wow, okay.
Now, another key takeaway from this study
Okay.
is the potential impact of treatment duration.
Oh, yeah, we talked about that a little bit before.
We did.
The longer they were on phenobarbital, the more likely they were to develop certain cytopenias.
Exactly.
Right.
Specifically, leukopenia and neutropenia seem to be more common in cats that had been on the medication longer.
So vigilance is key.
Yes.
Especially for those cats who've been on it for a while.
Absolutely. And in some cases, it took months for these cytopenias to develop.
Oh, wow.
So that just highlights the importance of ongoing monitoring, not just in the initial stages of treatment.
It's easy to become complacent when they've been doing well on a medication for a long time. But this is a good reminder.
Yeah.
That we can't let our guard down.
I couldn't agree more.
Yeah.
Now, it is important to acknowledge that this study, like any study, has its limitations, being a retrospective study.
Right.
It relied on data that was already collected. So there's always a possibility of some information missing or, some inconsistencies in the data.
So we got to take the findings with a grain of salt.
To a degree, yes. The researchers themselves even acknowledged the need for further investigation to confirm these findings.
What kind of further investigation?
Well, for one thing, they acknowledged that bone marrow exams were not part of this study.
Okay, why is that important?
Because examining the bone marrow
Yeah.
can really give us some invaluable insight into why these cytopenias are happening.
Oh, okay.
It can help differentiate
Okay.
between, whether the problem is with the production of blood cells in the bone marrow or whether the cells are being destroyed in the circulation after they leave the marrow.
So not having those bone marrow exams really leaves us with some unanswered questions.
Precisely.
Okay.
And it's also important to remember that this study focused specifically on cats with suspected idiopathic epilepsy.
Meaning epilepsy with no known underlying cause.
Exactly.
Okay.
So we can't necessarily extrapolate these findings to cats with epilepsy due to other conditions like brain tumors.
Okay, good point.
Yeah.
So we got to remember
Right.
that this is a specific population.
Exactly.
This might not apply to all cats on phenobarbital.
Absolutely.
Yeah.
And as with any medical study,
Right.
there's always a possibility of other confounding factors that weren't accounted for, such as concurrent illnesses, other medications the cat might be taking, even individual genetic variations.
Right.
All these things could potentially influence how a cat responds to phenobarbital. It's a complex picture.
It is.
Yeah.
But even with these limitations, this study provides us with some valuable food for thought.
I agree.
It raises awareness about a potential side effect of phenobarbital that we might not have been fully appreciating before.
Yeah. It really stresses those regular checkups.
Yes.
Blood tests.
Absolutely.
Even when a cat seems to be doing well on the medication.
Couldn't agree more.
So what would you say is the main takeaway message for listeners today?
Well, I think the most important message is this.
Okay.
Phenobarbital can be a life-saving medication for cats with epilepsy.
Right.
It's generally safe and effective.
Okay.
But like any drug, it does have potential side effects.
Right. And in this case, those side effects can include this whole range of blood cell abnormalities.
Exactly.
Yeah.
And while those cytopenias are often mild and don't cause any noticeable symptoms, we still need to be vigilant.
So regular monitoring.
Open communication with your veterinarian.
Absolutely.
And a willingness to adjust treatment if needed are essential.
I couldn't have said it better myself.
Yeah, so if your cat is on phenobarbital, don't panic.
Right.
But be informed.
Yes.
Be proactive.
Absolutely.
And work with your vet
to
make sure your feline friend stays happy and healthy.
Wise words.
It sounds like this study is really changing the game when it comes to how we approach phenobarbital in cats with epilepsy.
Absolutely.
We can't just prescribe it and hope for the best anymore.
Right.
We got to be proactive. We got to be vigilant.
Yeah.
But I imagine some listeners out there might be feeling a little overwhelmed.
I'm sure.
So, if their cat is on phenobarbital, what steps should they be taking?
Well, the first and most important thing is to talk to your vet.
Okay.
Have an open and honest conversation about this study and its findings, and really figure out what kind of monitoring plan is best for your cat based on, their individual circumstances, what dose they're on, how long they've been on the medication, other health factors.
So knowledge is power.
Exactly.
The more you know, the better decisions you can make for your furry friend.
And, it's important to remember that even though this study focused on cats with idiopathic epilepsy, the findings have broader implications.
Okay.
So if your cat is on phenobarbital for any reason, regular blood work monitoring is a wise precaution.
So it's not just about this particular condition.
It's about being aware of the potential for these blood cell changes in any cat receiving this medication.
And while this study raises concerns, it's not a reason to panic.
No, not at all.
Phenobarbital is still a valuable tool.
Absolutely.
For managing seizures in cats.
It is.
The key is using it responsibly with informed awareness.
Couldn't agree more.
So we've covered a lot today.
We have.
We've talked about how common cytopenias are in cats on phenobarbital. Different types. Severity. Emphasized how important monitoring is.
For sure.
What's the one thing you want our listeners to take away?
I think the take-home message here is don't panic.
Okay.
But be proactive.
Okay.
If your cat is on phenobarbital, talk to your vet. Get that regular blood work done.
Okay.
Stay informed.
Be informed.
And by working together, we can ensure that our feline companions get the best possible care.
Absolutely.
While minimizing potential risks.
That's a great message to end on.
Thank you.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.